We're starting with a YouTube comment this week.
Well, that is against the rules. That is illegal.
You didn't let us guess.
Well, you never guess right.
My freedom has been taken away from me.
The YouTube comment is on the After Dark episode from last month, or this month. One of the months. After Dark is our brand new show that we've got only on our Patreon for certain patrons. You can go there. Just because SCI Guys has ended, it doesn't mean that the conversation has. And Melody says, I adore these videos. I specifically changed over my Patreon so I could get these. Like, I obviously do have an interest in science, but honestly, my main reason for watching is also your personalities. So After Dark is perfect. Feels like the kind of conversations I have with some of my friends, even down to always coming back to capitalism bad. Can't wait for the next one.
You know, this morning, you can cut this out if it's not good for time, but this morning I was watching a documentary about Tony Blair with my breakfast, and they were like, and they were talking about one of his friends at university, and they were like, and he was extremely radical, like taking down capitalism radical. And I was like, that's my friend Corey.
Our little Overton window has shifted. And my question for everyone listening and watching, get over to YouTube and get in the comments and answer this question. Do you get sleep paralysis?
No.
No? No, you don't.
No, I don't.
But I do. We'll find out about that in a bit.
Do you know somebody who does, who also is an expert in that?
We'll find out soon, won't we?
Let's start the show.
Should we start the show?
Let's start it.
Let's just start it,
immediately.
please.
Right.
That's
now.
Cool.
Hello and welcome to the SCI Guys, the show where we talk about the crazy, weird, and wonderful stories from the science world. I'm Corey, and as always, I'm joined by my co-hosts Jamp and Luke Cutford.
Hello.
And this time, very special guest,
Whoa.
Dr. Baland Jalal.
Hey.
Hello, woo!
Thank you so much.
This week, we're talking about dreamy demons and sleepy science.
Very good.
So, we've covered sleep paralysis before on the show, back in episode 91, but we're coming back to the topic because there's so much more to say, and also because our guest this week is a true expert. He's proposed a potential method to help ease sleep paralysis, meditation, relaxation therapy, and knows an awful lot about dreams. Isn't that true?
Cool.
Well, yeah, thank you. That's very nice of you.
So, in a way, you've actually already featured on the show, because I used one of your studies in researching the last sleep paralysis episode. Yeah. So if anyone sort of that watches or listens to the podcast has a look at the references, they might know you already if they don't already know you from the rest of your work. So
that's really cool.
It's really cool, right? It's fantastic. So you're a researcher. You're a researcher at Harvard University, right?
Right. Yep.
And you've published over 45 papers. You focus on sort of neuropsychiatry, specifically sort of sleep paralysis and OCD as well. You've done some work with OCD.
That's right. Yep.
Yeah, fantastic. And the Telegraph has described you as one of the world's leading experts on sleep paralysis. You were ranked the top-rated expert in sleep paralysis in the world. And you're also one of the most 15 interesting people on sleep. I think that was by Casper Sleep, which is pretty amazing.
Sorry,
wow.
Casper Sleep, the mattress company.
Yes, Casper Sleep.
Weird honor, but a great one too.
Yeah, fantastic. So, I mean, it's an absolute honor to have you here. And as well, as I was saying, you've got a YouTube channel as well where you post a lot of things there. I think the Baland Jalal show, which I've...
Yeah, we watched it the other day.
Yeah.
All together.
Corey put it on the television. Did I? Yeah, you did.
Oh, I did, yeah. No. So you've got, I mean, about a decade of experience with sleep paralysis, studying it, not just experiencing it. And also, I think one of the most interesting things to me is you gave a lecture at UCL whilst I was studying there in November of 2017.
What?
Yeah, it's very cool.
This is crazy.
I know.
Destiny.
Wow.
So many...
That was really funny. I didn't know that. So you were in that lecture when I gave that talk?
This is the thing. I was not in that lecture because it wasn't. I did biochemistry. So I wasn't invited to that lecture, unfortunately. I know. I was really lined up.
Almost your worlds collided.
Well, I recognized the lecture hall because I spent most of my time in there.
Well, you shouldn't have taken biotechnology, should you?
No, I shouldn't have. I should not have. No, but that's what I'm saying. So many sort of misconnections there. But yeah. So I think we should probably start by doing a little maybe recap on sleep paralysis.
Yes, please.
Yeah.
I'm a bit rusty.
Well,
If there's any
I
more to
feel like
say.
maybe you shouldn't do the recap.
Well, that's what I'm saying. Yeah, no, absolutely. Yeah, go ahead, please. Could you maybe give us a sort of brief intro on sleep paralysis?
Oh yeah, of course. So sleep paralysis is this fascinating phenomenon. I mean, imagine you're lying there sleeping in REM sleep. So let me actually give some background to this. So sleep paralysis per se emerges out of REM sleep. So each night we go through different stages of sleep, and one of these stages is called REM sleep. And during REM sleep, we have vivid, lifelike, and crisp dreams. And this might be the weird dreams where you see yourself wrestling with an alligator or whatever, right? So it's really vivid and crazy and strange dreams, right? Now, your brain is clever. It says, look, I don't want Baland, right, to act out his dream and hurt himself, so I'm going to paralyze his entire body. And this is, there are structures in the back of the brain, right, in the brain stem that is responsible for this paralysis. So each night we're all paralyzed from head to toe. Now, occasionally what can occur is that your wakefulness centers of the brain can prematurely activate. So you find yourself awake, cortically, mentally, you are awake, but you're paralyzed at the same time. And so this is dysynchrony to the architecture of REM sleep, you can call it. So you are, awake, mentally, you can see your surroundings, but you're physically paralyzed. And in about 40% of people, you would see, you'll see strange hallucinations, ghost-like creatures approaching you from the corner, and things like that. So yeah, creepy phenomenon, but it's really, I guess the way to put it is it's a clash of worlds, the bizarre, strange, and surreal world of dreams clashing with wakefulness. So I think it's the only phenomenon in the entirety of medicine, if I'm not mistaken, where you have this clash of these two parallel worlds. So yeah, quite a striking phenomenon.
That's amazing.
Absolutely
I've
fantastic.
never experienced it, and it sounds terrifying.
Have you not?
No.
I thought you said that you had in the last episode.
No, I've woke up feeling scared, but I've never actually witnessed anything.
The hypervigilance. I actually had fantastic. I actually had a sleep paralysis episode this morning in preparation in preparation for this episode.
How good of you.
I know, lucky me.
Doing your research, yeah.
Yeah, I mean, gotta experience it yourself. But I think what was interesting when I was sort of looking at your work is you've got is it the SPEPQ? The sort of I guess sort of questionnaire test you use to test for sleep paralysis, which is something I found quite interesting.
Yeah, that questionnaire. So that questionnaire is basically a way we have to sort of, when we interview patients with sleep paralysis, or people even, like, you don't have to have chronic sleep paralysis, but just it's a way to really understand the richness of the experience, what people see, the hallucinations and things like that. But Corey, that'd be interesting. So you had a sleep paralysis this morning, and this is what I study and I find fascinating, much more than this instrument we devised. So tell me, what did you see?
You're about to get diagnosed.
No, this is the thing. I don't. What did I see? Nothing. I've had sleep paralysis so often in my life, and I think I was looking at sort of the MR therapy, the meditation relaxation therapy, and I realized that I might have brute forced my way to it slightly. So whenever I get sleep paralysis now, there's no sort of hypervigilance. I'm not necessarily hallucinating anything. I'm just kind of sitting there waiting for it to end.
Yes, you've said this before, where you've sort of built up an understanding of it. Mm-hmm. So you just go you consciously are just this again, right? And then you just wait it out, which is really interesting. Have you experienced that before, Baland, in people?
Oh yeah, all the time. I mean, that is, the thing about sleep paralysis is that you have this sort of window of conscious awakening, right? So you are mentally awake. You have seconds to minutes where you are mentally, cognitively aware, and that's why that's how my therapy came about. Because even from my own experiences, I would wake up and I'll sometimes be terrifying hallucinations, which is normal, but you can utilize those seconds of sort of awareness to meditate or put your attention onto something positive, which is sort of a key step in my therapy, but definitely and during my own experiences too. You have this wakefulness component to it, right?
So you're almost using the sleep paralysis as a tool to strengthen your own kind of your ability to stay calm in a scary situation.
Yeah, Luke, exactly. So the way to put it, the way to see it is exactly. So if your brain is undergoing a very stressful, a very terrifying experience, you will have fear centers of the brain become overactive, right? And so a way to modulate that, control that, is by voluntarily relaxing your body, and in that way sort of calming the experience. And over time, if you do that, that should eventually lead you to not have that conditioned fear response. So absolutely, that's a core step of the therapy, and it's core step of any sort of terrifying experience to be able to relax yourself out of it. So definitely.
That's really cool.
What I find really interesting about this is obviously the relaxing your way out of it it's probably the best way. I had a slightly different method. I think we spoke about this last time. I had a slightly different method of getting out of it when I was a teenager, which was forcing my body to move so much that it almost became painful, And then sometimes it
yeah.
felt like it would work. It felt like my brain was building up with static.
Yes.
And then suddenly I'd be able to move and I'd be like, okay, cool, it's over. You know?
He's trying to like force you out of it, like
Yeah.
pushing through.
But do you think that actually works? Or do you think you just try to move and eventually the thing that like paralyzes you gives it like, turns off?
Honestly, yeah. But it was something to do, you know? It was something to focus on.
That's interesting, Corey. So my question would be this. So, but this is actually something that people do. It's a technique that people utilize, and it's even suggested as a form of way to get out of sleep paralysis. When you do that, do you try to wiggle a toe or move a finger, or just push yourself out of the experience? How do you sort of go about doing that?
So usually, I guess I'm lying down. So yeah, usually I sleep lying down. So it would be kind of a sitting up motion, like kind of moving, trying to force my chest and head to move forwards, just like really like struggling, like this, you know? And it kind of, then obviously there's not necessarily pain. It's just like, as I say, like static building up from the areas that I'm trying to move. And then it does feel like I sometimes just sort of snap out of it. But as Luke said, whether that's a case of it's just ended on its own.
I think you're right. I mean, so that is something that people do. So my question would be, or what we observe is that when people try to move, is that often they will have a spasm-like sensation in their limbs. So that's often common the case because you're trying to move, but there's no feedback coming back from your body, right? So it can often worsen the feeling of pressure on the chest and the body when you try to move. Was that your experience, or did you eventually just not really feel that and just come out of the experience?
So I suppose actually, yes. I don't usually get that much pressure in my chest, I guess, because I kind of almost filter it out. I'm kind of used to it at this point. But yeah, I guess it does feel like I'm pushing against something when I am trying to sort of move. So that pressure would then increase.
And I'm interested, the pressure on the chest, is that just the brain trying to make sense of the fact that I am trying to move, but I can't move, therefore something must be on me?
No, the way to look at this, Luke, is think of this as a REM phenomenon. So REM sleep, right? So REM sleep, the stage of sleep, has its own peculiar physiology. And one of the features of REM is this automatic breathing. So you breathe like this, right? It's automatic. And so when you try to control that, which is a normal thing. So if you find yourself awake and you breathe like that, you might try to control your breath. And that controlling of your breath will lead to a spasm-like sensation in the last. So because it's sort of it's a contradictory thing, because you have your breathing is already automatic, and so that will lead to that pressure sensation is one major theory, because you're going against what your physiology is sort of dictating for you at that moment. And that's the same thing with the limb. So people will say they feel like something is holding them down, right?
Yeah,
I've heard that.
And so again, what is that? Well, you're lying there paralyzed, right? And you are sending, so your neurons in your brain, in the motor area, will send command, Luke, move, Baland, move, you're paralyzed, get out of here, right? But since there's no feedback from your paralyzed body going back to your brain, that can feel, and that, feedback coming back to your brain is normally dampening in nature. But because it's not there, that can lead to a spasm-like feeling, or a feeling that something is holding you down. And so let me give you a concrete example. I don't want to be too abstract on you guys, right? So, phantom limbs, people with phantom limbs.
Yeah.
So one thing for them feeling phantom limbs is exactly something along those lines. There's no arm, but there's a sensation of an arm in the body image. Is that clear, kind of? So the whole idea with phantom limbs is that when you cut off the limb, or the limb is amputated or whatever, right? Because in the brain, in a region of the brain called the superior parietal lobule, a fancy name for an area where your sense of body is sort of mapped on into that part of the body.
Is that like the homunculus?
So, in a homunculus, exactly. There you go, Luke. Right? So there's the homunculus there, right? And so when you amputate the arm, the homunculus remains intact. And that's why the sensation of an arm is there. Okay. But if the arm was in a spasmy position and you're not able to move. So let's say somebody has an arm amputated in a motorcycle accident, presumably the arm was actually in a sort of awkward position when it was cut off. And there's no feedback coming back to your brain to relieve your arm of that pain. So that would be an equivalent example of why you need proprioception. This is called proprioception. The feeling that comes back from the limb is called proprioception. It's a technical term again, but what it does, it leads to that dampening sensation. And during sleep paralysis, proprioception, meaning feedback from the limbs coming back to the brain, is absent, and that can lead to a sense of pressure. That can lead to a sense of spasmy feeling, and even lead to some of the bodily hallucinations where you see your limbs floating in the air and things like that. So it's quite the phenomenon, the sleep paralysis. Yeah,
I think it's really interesting. In sort of looking at what you've sort of studied, I realized my sleep paralysis is very mundane. People seeing their sort of limbs floating, everything. I sort of almost hallucinate that I am exactly where I am, maybe in a slightly different position. So, for example, today I was asleep on my sofa, sitting up on my sofa, and when I had the sleep paralysis, I thought, I'm sitting slightly lower on my sofa, like as in sitting on the ground with my back on my sofa. And I woke up and I'm like, how did I get here? You know? But like, obviously, as I say, my sleep paralysis is very boring. But
yeah, my sleep paralysis is always like, there's a demon coming to get you, or like you're trying to scream but you can't. It's like mine are always horrible and traumatic.
Awful.
Yours are like, I'm here and I can't move and I'm aware of that. Right, well, I'll just wait.
That's fascinating, right? So you have two examples. One, I'd say Corey's sleep paralysis is an example of the self being slightly shifted. So there's a shifting of self, right? And this shows us, first of all, that the sense of self, the feeling of an I, is created in the body. It's scaffolded and created in the brain, and there are centers involved in creating that sense of a body image, a sense of a Corey. And that is shifted during sleep paralysis. And that is a region called the TPJ, as a fancy name for a structure that generates that feeling. And so you are experiencing a slight shifting in that. Whereas we have Luke seeing ghosts and demons, which is another way where you can experience sleep paralysis, where you sort of project a sense, the fear is sort of hijacking your brain and leading to these more terrifying hallucinations, which is common. So yeah, it's fascinating that we have both on the board today.
What I find really interesting is that I used to be a lot like you, Luke. When I was younger, when I was a teenager, I was getting this so constantly. I had no idea what it was. And it was upon learning what it was, looking into it, and being, oh, this is what this is. So whenever I sort of woke up almost, I wouldn't be like, oh, there's a demon after me. I'd be like, oh, there's a demon. No.
Don't trick me.
No demon here. One thing I did find really interesting when I was reading some of your work, Baland, was sort of you wrote something on the importance of interviewing over self-reporting for this, and I found some interesting things that people had confused with sleep paralysis.
Yeah. So, you digged up some really old papers, man.
I went all the way back. I found on Google Scholar, I think there were a couple of reviews of Wes Anderson films from 2011 there.
That's really old stuff.
I mean, if you don't mind, I thought this was really interesting because it kind of because Jap, I remember on the last episode you were talking about potentially maybe having sleep paralysis, and we kind of figured out that actually you hadn't, and you had gotten it confused, and I thought that was really interesting as an example of this is something that has been shown in that sort of research, and it happened on the podcast here.
Yes.
So some of the things that have been confused for sleep paralysis, someone confused it with a dream. Someone confused it with having a dream of like sort of being chased, but not being able to escape. Someone confused it for waking up really, really, really exhausted and feeling like they couldn't move because they were so exhausted. But yeah, I know, right?
Easy mistake
to make. Yeah, absolutely. But I think it's interesting because it just comes down to how we sort of describe this stuff.
Yeah.
And obviously, I mean, you've described it very well. And we had a lot of viewers before that I think were confused about this. So I'm glad that we've managed to sort of get a really good description for people so they can understand what it is.
It's very interesting, right? So you see sleep paralysis, even though we define it in the traditional way is like you are awake, during sleep onset or offset, meaning when you're about to fall asleep or, awaken from sleep, you are aware of your sensations, or you're paralyzed, but you're aware of your surroundings. So it's there's a clear definition, but at the same time, you see, as you mentioned, and which is known in the scientific literature, that it's really on a continuum, right? So you have people that feel like they're half asleep, or maybe they're dreaming, and in their dream, they're kind of paralyzed. They can't move. This is because, waking and, being wakeful and being in REM, you can tilt in and out of that. It's not this clear cut thing, even though sometimes, of course, you have the classic and traditional experience. Definitely it can vary. And I want to touch upon that whole interesting dream that people experience where they try to they're being chased by a monster and they can't get away. Do you experience that once in a while?
Yeah.
Yeah.
Universal
I've had the dream, yeah.
I've had that dream, yeah.
As in, so when you say that, sorry, do you mean like they're being chased by a monster and they stay roughly the same distance from the monster, as in they can't get further away from it?
Well, something along those lines, right? So the universal phenomenon that when I go lecture anywhere, right, people will tell me, the dream that I experience is that I'm trying to get away, but I'm either heavy, I feel like I'm in quicksand, or my boots are really heavy and the monster is chasing me and things like that. So it's kind of a universal phenomenon. And certainly as a kid, I used to have that dream all the time. So the question, what is going on in the brain? That is the main question. And again, this is explained by science and looking at the sort of how the brain works during dreams, which is, and this is actually key for understanding sleep paralysis as well, potentially, which is, when you are in dreams and you're having REM sleep, what's happening is that your, the part of the brain known as the cortex, the outer layer, right, is not working as it should. We call this outer layer the CEO of the brain, or the head office. It's not really doing its work as it should. It's sort of a non-functional state. And part of this area is the movement part of the brain. It's not getting its fuel, which is this chemical called serotonin, right? So this is not working during sleep. However, during dreams, the emotional part of the brain during REM dreams, that part of the brain is hyperactive. Okay, so your emotions are flaring up, right? You have a lot of emotion, a lot of instinct, right? And that's why you have things like sexual dreams and stuff like that. But you can't get away is because you don't have the fuel for your brain to send, to use this part of the brain, the motor areas of the brain. So in a way, you can say you not being able to move represents your motor cortex being weakened, and that monster represents that emotional part of your brain being overactive. So there is that, dreams, a key component that can be explained in terms of neuroscience. So
that's super interesting. One question I had was about Corey waking up from his dreams, and he's sort of going, right, I'm having sleep paralysis, I'm aware of it. That's quite like higher level reasoning, right? And does that just wake up like pretty quickly?
Well, that is one of the key features of sleep paralysis, that you are aware, that you know that you are in sleep paralysis. And this is an important thing, right? So during dreams, the self-agency part of the brain, so the part of the brain that's up here, again, in the CEO of the brain, the part that has to do with knowing that you are aware of yourself, right? That part of the brain is knocked out. It's out of whack, that neighborhood of the brain. So that's why when you're dreaming, you don't know you're dreaming. That's the whole thing. So you find yourself in this world where you're unaware that you're dreaming, which makes it much more realistic, by the way, right? So it feels much more real. But during sleep paralysis, because you have partial awakening of that region of the brain, you suddenly find yourself awake and aware of the situation, but yet you are paralyzed. And that's the whole paradox. You are awake and you know you're awake, yet you see a monster in front of you. You see this ghost in front of you, and you can't do anything about it. So this happens to me all the time. Well, I have sleep paralysis, I'd say maybe once or twice a year, right? And I wake up, I'm paralyzed, and I say, my God, this is sleep paralysis. And I know a lot of stuff about sleep paralysis. Yet at the same time, I cannot help but feel fear and terror. It shows that it's sort of an organic sense of fear in your brain that's being sort of hyperactive. And then you see a ghost, and you know what this is about, right? You have a theory about why people hallucinate ghosts, right? But at the same time, it feels so real subjectively as this conversation you and I are having right now. So you almost go, oh, which is more real, this experience I'm having now, or the real life? It's that immersive and subjectively compelling, and that's, I guess, that's what it's about, right? It's this really realistic experience.
I think that brings us on to something that it kind of is a nice segue into something really interesting that is sort of prevalent throughout your research, which we haven't touched on this podcast before, is how sort of sleep paralysis is different across different cultures. Like I've seen you sort of gone to Italy, you've gone to Egypt, and there's sort of different. So we talk about our sleep paralysis demons, but there's different sleep paralysis demons that are somewhat consistent across different cultures, right? Or specific, as in sort of specific cultures. Would that be right?
Well, that is exactly correct. So correct. So we've done research in a bunch of countries, and what we find is, on the one hand, sleep paralysis is very, very universal in its sort of what we call the phenomenology, meaning people will experience chest pressure, and then they hallucinate a shadow-like being. It's usually a faceless creature. And we certainly have theories about what's going on in the brain. Why you would see a faceless creature? Why can't your brain does not hallucinate the whole damn thing, right? Why do you see a faceless creature? But all of that stuff we have an idea about. But then on the top of that, you have the cultural element where each culture seems to elaborate on the experience. So let me explain. So in Italy, people will talk about witches and giant cats coming and attacking them and choking them, potentially killing them. You can imagine for the Italians of the Abruzzo region specifically, sleep paralysis, it's something that's, terrifying. It's something that is quite the thing, because it's no longer just, your brain playing tricks on you. How, in Egypt, for example, it's the evil genies of Aladdin. So have you seen Aladdin?
So the jinn, right?
The jinn, exactly. So that is an interpretation there, right? So people talk about a jinn, and typically, some people will say they won't elaborate on what the jinn look like, what the genies look like, but some will say it's sort of it has a bloody face and things like that, and it's like a terrifying creature. But then you have, on the other hand, a place like Denmark, where people will say, no, sleep paralysis, in fact, is just the brain, teasing you. It's just your brain, generating this experience. And so we thought, well, this is interesting. So you have these cultural ideas about sleep paralysis, but let's then compare a culture like Egypt, for example, where sleep paralysis is supernatural and terrifying, and compare that to Denmark using that questionnaire you mentioned, right? To, really go into depth and see if there are any differences in terms of the experience then. And what we found was intriguing. So we found that sleep paralysis in Egypt was 3 times more common in the people who experience sleep paralysis. So for those guys, it would happen 3 times more commonly, so they would have it all the time compared to the Danish people. And then we found that not only that, they would also feel terrified of the experience. So for the Egyptians, they would have excessive fear. So like 50% of the people would say, look, I might die of sleep paralysis. And they would say, my paralysis feels much longer, as if it's prolonged. The experience, in other words, has become much more salient and dangerous and terrifying, right? And almost like a nocebo-like effect. You know the nocebo effect?
Mm-hmm.
The nocebo is the opposite of the placebo. The placebo is, I give you a sugar pill. I say, look, Corey, take this pill and you will be the best person in the world to play basketball, like the Space Jam. Placebo. The nocebo is the opposite. I tell you, look, this pill here, you take it and you'll die from it. Okay, you take it and literally your body will react to it. And we think it's a similar effect culturally that's going on. Because of the cultural ideas, the experience is changing. So let me give you a concrete example of how this might work. So this is what I call the Little Lisa example. So you have this little girl called Little Lisa. And by the way, this might be the punchline of my decade-long research, which is this sort of theory and this work. It goes something like this. Little Lisa, she's having dinner with her grandmother. And the grandmother would say on this island, look, there's this monster. It's called the boogeyman. It will come at night. It looks like this and that. It might choke you. It might sexually violate you. It might, potentially even kill you. So it has all these features, and she'll describe in detail how the creature looks and stuff. Now, Little Lisa, mind you, she has never experienced sleep paralysis in her entire life. Okay, never. She goes to bed, and then she will experience sleep paralysis for the first time. And the question is, why and what happens? Well, first of all, she's lying there paralyzed, but she has fear parts of her brain being overactive. So she has anxiety and stress. And anxiety and stress can do what? Well, it can sort of make your cortical regions, the part of the brain that has to do with awakening, to become hyperactive during the REM phase and wake you up. So this is one component to this. Second, when you are expecting something, I'm expecting something, I'm almost primed then to experience it. So Little Lisa will sort of monitor paralysis sensations in her body. And when she sort of feels like she's half awake, she might try to move to see if there's something there holding her down. And so when she tries that in a conformatory way, she will wake up during the sleep paralysis REM phase where she's paralyzed every night, right? So she'll wake up and lo and behold, she'll see a creature, a shadow-like being, and then she'll project her cultural ideas into that being because of now the ideas, what we call dream mentation, REM mentation, meaning the ideas of her imagination and memories, taking over. And then she sees a ghost. She wakes up, she's terrified, okay? And then she might go tell her friends about it, right? Now, they are also predisposed to potentially having sleep paralysis. Now, that fear will lead her to have another sleep paralysis 2 days later and a week later, and it then potentially becomes chronic now, and she becomes more and more and more terrified over time, and potentially she might even develop mental illness. And this is really where it becomes mysterious. So we think, and our data suggests in a preliminary way, meaning it's not 100% confirmed, but it seems like potentially having these huge traumas, like seeing these ghost-like creatures, like continuously over time, and developing anxiety and fear around that. So it sort of escalates with each episode, it becomes worse and worse. Or the creature is not only there to attack me, I'm possessed now. It's personal. You see what I'm saying?
Yeah.
And then over time, these becomes minor trauma in their own rights. So small traumas accumulate, and over time potentially can lead to maybe PTSD-like experiences, actual trauma, maybe anxiety. That's what our data seems to potentially point at, which is really interesting. So from having ideas put into your mind as a little kid, right, about cultural ideas, to now potentially develop something like trauma, comparable to somebody who's in war just from sleeping. So this is what I suggest that might be one of the most mysterious and fascinating condition in the entirety of medicine, because we can extract something like that. So
that's really interesting. So what it sounds like you're saying is that like cultural ideas of like demons or like creatures that come in the night to get you, that sort of primes your anxiety so that you're more likely to try to wake up in your sleep, which
exactly.
and then that kind of spirals and spirals. But the key thing that there it sounds like is that the kind of initial like the genesis of that is the cultural ideas of sort of monsters, demons, and spirits, etc. Would that be fair to say?
Yeah, that is fair to say. And in fact, if you look at those who have the highest rates of sleep paralysis, is college students with disrupted sleep and anxiety and stress for exams. They have some of the highest rates. Right? So exactly, right. So you have that anxiety, and that predisposes you. But I want to add here, it's important to note, and this is our research really suggests this. At the same time, there is a key component which is biologically based, meaning if you are on a desert island, you would, likely, hallucinate ghosts and things like that too. But however, there's an element of culture, added onto that. So in the US, for example, some people will talk about space aliens, abducting them. And it seems in some cases, maybe not in all, but in some cases, it might be something along sleep paralysis, people have suggested. So there is an extra layer of culture. Let me give you a concrete example. There was once a reporter interviewing for maybe 7-8 years ago from New York. And during the interview, she told me, look, my own sleep paralysis in New York is about burglars, people coming into my house. And
I get that. Yeah, I get that all the time.
Mm-hmm. So it all depends on sort of your culture in a way. But at the same time, there is a shadow-like creature that's universal. It tends to be faceless. It tends to come from the window or the corner of the room. It tends to have these features. And believe it or not, I actually have theories about why it's faceless, why the windows, why all this, because of the underlying biology of our brain that can sort of try to get at these things.
I'm just going to throw this out there. Would that be, off the top of my head, would that be because we struggle to sort of construct a face, right? Is that because I've and you could probably confirm whether this is true or not, but I've heard a lot of people say this, that the faces that you see in dreams are not sort of new faces. They're faces that you've seen before, because a face is a very difficult thing to construct a sort of believable version of.
That is fair. So the theory might go something like it's, they're simple and complex hallucinations. And for your brain to simply hallucinate a shadow-like being, it's simpler. So if you have an idea of a ghost-like creature in your room or a terrifying presence, so some people might, just hallucinate a sense presence. It's called a sense presence hallucination. So they might have that. But hallucinating a shadow-like creature and having an idea about where it is in space, that's adaptive in terms of your survival. You don't need to hallucinate all the features. So your brain is computationally, it can use your computation and your brain power, so to speak, to more important tasks instead of hallucinating all the details. So absolutely, I mean, I believe it's a simple hallucination in that way because your brain, and especially specifically your visual systems, try to get away with as little work as possible to get the job done. This is well known in vision science. So I think that's what's going on here. And so, yeah.
I'm guessing as well that these sort of scary hallucinations, as far as I've been able to tell from what you said, come pretty much just from the fact that your emotional system is overactive when you're sleeping, or maybe overactive when you're sleeping. And so would it be fair to say that if those hallucinations are based purely on just, I know that I'm scared right now, so what am I scared of? And then trying to hallucinate something to make sense of the fact that I know that right now I am scared. Is that correct?
That is correct. But let me add here. So it's not only the fear and anxiety centers. So I want to be really simple here, but let me go through the things that we think are involved. So first of all, there's a sense of body image being projected, meaning, okay, what do I mean? So your sense of self gets distorted during sleep paralysis because I mentioned you have signals from your brain saying, Baland, move, but there's no feedback coming back to this part of the brain where you create a sense of a body image, where the homunculus is created, where you integrate information in the world in a cohesive way and create a sense of Luke. That part of the brain doesn't work, right? And in fact, so let me give you, so let's look at that for a second. If I, was to zap Luke using an electrical current right now in this part of the brain, you might feel like you're floating out in space.
Wow.
Okay?
Cool.
So we can create out-of-body experience in that way.
Yeah.
Right? So this is the first point. So your sense of self is created in the brain, and if we, mess with that part of the brain, if it's out of whack for some reason, there's not enough oxygen going to that brain, you will feel like you'd have an out-of-body experience. So that's the first thing we think is going on. There is a dysfunction to the parts of your brain that has to do with sense of self. So in other words, we think that explains the out-of-body experiences, but also then it makes sense that you can interpret that ghostly figure, which can be yourself occasionally, but you can also interpret that as a exogenous other being. You know what I mean? Let me explain this. So when you see a human being in your dream, it's yourself creating that other human being.
Yeah.
You know what I mean? There's no other person in Luke's dream. It's you creating a different.
Yeah.
It's me.
You're the stage, the script writer, the actors, and the audience. It's
Exactly. You are all the roles, right? It's you. Okay. Very interesting. Now, what you notice during sleep paralysis, the point is you create that. Let's go with the out-of-body experience. So occasionally you see a Baland floating out in space, and I've had that hallucination. And I have a discussion with this person. I said, "Look, I'm the real Baland," and he will say, "No, I'm the real Baland." So there's almost a fight in terms of agency. Who's the real agent? Who's the real Baland? You know what I mean? So this is actually a common thing, but you can see how that can totally decouple now, and where that other being out there, it's no longer you or that shadow or whatever you're hallucinating, but it's a different person, and you project agency and intentions into that being. And while you're doing all this, of course, the anxiety parts of the brain, so you mentioned that, the fear centers of your brain is also pushing you towards the interpretation. So it says, look, no, it's likely a dangerous creature. It's likely a predator and stuff like that. So it's always there, directing the script or sort of pushing you towards a certain interpretation. So I'd say that is a key part of it. And then a third component, which I want to add, aside from your sense of self being messed up, it has to do with a receptor in the brain called the serotonin 2A receptor. Now, I won't become technical on you guys, but it simply means when you take a drug like LSD or psilocybin, you might activate a certain, receptor in your brain that makes you more likely to sort of project mystical and, meaning into sort of meaningless things. Right? So you can see if you are lying there paralyzed and you have this part of the brain being hyperactive, so everything is mysterious and otherworldly, and you have fear making you paranoid, like a paranoid trip when you take LSD, and your sense of self is projected out there. All of these put together, plus your brain is a great storyteller. So it goes, look, what is the chances of me feeling chest pressure? What is the chances of me feeling like I can't move? Something is holding me down. Well, all of this I must conclude, given all of this, there's a ghost here. So your brain creates a nice story around that. So I hope it's not too technical here, but that's what we think in a nutshell, what's going on. And anxiety is mainly it's almost like the bully telling you what to think or not to think. So So in that way.
One thing that's interesting to me, because I've read before for the previous episode that sleep paralysis isn't all negative. There are some people that have almost positive experiences of sleep paralysis. I was wondering if you might know anything about that, because it seems interesting to me that sort of, you've got the Americans being seeing sort of like being abducted by aliens. You've got people in Egypt seeing jinn, but there could be almost a religious or positive experience coming from a particular culture's view of sleep paralysis, right?
Yeah, absolutely. The way to think about that is, look, and this is exactly what Luke was talking about. If the anxiety and fear centers of the brain are, pushing you towards a certain interpretation and adopt a certain view of what's going on, and the emotional part of the brain talks to a region of the brain called the orbitofrontal cortex. Mm-hmm. It's a part of the brain that makes you interpret things in a certain way, stimuli in a certain way. And that talks to the visual part of the brain, making you more likely to see things based on your emotional experience. So if you can control your emotions using your mind, mind in a voluntary way, and dampen your fear and anxiety, potentially using my technique as I was talking about, then what you can do is that you can calm yourself down so you won't hallucinate these terrifying beings. You can make it less reactive, your brain less reactive in that way. So absolutely. And we see around the world people talking about, and this is rare, by the way, I'd say about 10% people will talk about angelic figures, religious experiences where it's more positive, or simply, things of that nature, less sort of typical. And that happens. And it seems like actually with using these techniques, you get more of that stuff. And potentially even you can potentially generate a lucid experience. So you have a lucid dream coming out of it, which also makes sense if you lucid dreams. So maybe we can sort of segue into that a bit, because it's sort of related here. So lucid dreams, which can happen during sleep paralysis, you become lucid during the event, but also certainly just you're dreaming in REM sleep, and suddenly you become aware of yourself. You're aware of the fact that you're dreaming. So those part of the brain that has to do with sense of awareness and agency turns on, even though you're dreaming. So it's kind of paradoxical, but then you can create your own wonderland. Now, during sleep paralysis, those parts of the brain can also become activated precisely because of what you mentioned, that sleep paralysis is this state that lies between wakefulness and sleep. And so you can have various centers activate. And so, potentially you might have a lucid-like experience during sleep paralysis.
Fantastic. If we could, you sort of brought up the therapy that you sort of developed. If we just quickly sort of touch on that. So just to let everyone listening at home, and also I guess Luke and Jamp as well, because
yes,
I haven't spoken to you about this yet. No. So you did a sort of pilot study on MR therapy, sort of the therapy that you sort of developed for this. Would you mind giving us a quick sort of overview of the steps of that?
Absolutely. So for me, the way that I, the reason why I developed it, first of all, was because of my own sleep paralysis that I had once in a while. I thought, look, let me just try various things. And one thing was to, try to see if I can manipulate the event using my sense of awareness. So the first step of the therapy is merely a simple one. I say, look, there's a lot of panic, right? Sleep paralysis sort of has this panic-like thing to it. So if I can take the panic out by merely, or simply reminding myself that sleep paralysis, it's something that's caused by the brain. So I close my eyes and I avoid panicking, and I remind myself of what sleep paralysis is. It's a common phenomenon, things like that. It's kind of a self-talk thing, right? So I say that it's common, it's temporary, it's benign, things like that. Then I emotionally distance myself from sleep paralysis. I say, look, given that it's just temporary and benign and common, well, there's no reason for me to be terrified. There's no reason for me to have psychological, fear and terror, because of this. So you kind of, go into that. And then here's a key step, because all that is well said, but what do you actually do? Well, you try to put all your attention onto something extremely positive. So you bring an attentional object into mind. So this could vary person to person. For some people, it's their mother's face. It could be a prayer for some people in some cultures. It could be anything that's salient and positive for you to take your attention away from all the scary stuff that's going on, right? Or potentially going on. And the idea behind this thing was, look, you have limited attentional abilities. Your attention is scarce. So if you can recruit your attention and put it onto something positive, well, that can in a way influence your emotional part of the brain, dampen that down a little bit and make you more sort of calm. And then the final step would be don't try to move. Don't try to, act out all your urges to move, because then that would lead to those loops of you trying to move and causing disruption to your sense of self, which we talked about. So it's these 4 simple steps that you would try to apply as much as you can in whatever, and then that would potentially help.
I just want to point this out as well. I mean, it was really interesting when I read it, because I was like, oh, I have done these first 2 steps I've kind of figured that out, like just through trial and error from having it for a long time. But we also do need to point out that this was that study, the pilot study with the sort of the 10 people, that was in people with narcolepsy as well.
Yeah, exactly. So that was a small pilot study we did with the University of Bologna hospital over there and in Italy. And yeah, exactly. So we found an improvement, about 50% reduction in sleep paralysis over 8 weeks. It was quite a drastic effect, but it was patients with narcolepsy, which is actually positive, because these guys have a sort of more severe organic brain disorder. So and the fact that you can change sleep paralysis in these people, the frequency of sleep paralysis, that's really positive. So that's a good thing. But of course, it's a pilot study, it's a small study. So we need to do research in large controlled trials, which is always the case, but definitely a first step in the right direction.
It's really interesting as well, because you say you've got these 4 steps. So like, if you say, like, for example, step 0 is I've woken up with sleep paralysis. And then you've got step 1, 2, 3, 4. The first question would be, does it become easier to go through those steps as you do it? So you like practice it, and then the kind of follow-up question to that would be, are you sort of, to a certain extent, like hardwiring, by practicing it, are you sort of hardwiring these steps in so that they actually just happen automatically as soon as you wake up with sleep paralysis, or even you don't even get sleep paralysis as much because sleep paralysis equals step 1, 2, 3, 4 automatically?
Yeah, no, it makes a lot of sense. So exactly right. So it seems like you also saw some of my lectures, maybe. That's exactly right. So we're trying to rewire the brain in a way, make it sort of react automatically to sleep paralysis in a different way, right? So instead of having that fear reaction, you sort of train yourself to go through these steps in a more automatic way, and potentially eventually rewire your brain. Look, your brain is really plastic. Your brain is malleable. It changes. If you go and encounter fear with a relaxed mindset all the time, over time, then the neurons in your brain that has to do with a certain event and the fear will eventually turn into calmness because of you using your brain differently. So that's what we're trying to achieve here. And so exactly, we're trying to create that automatic change that automatic reaction into a positive one. So that was the second. What was the first question?
Well, just really, I mean, the you've kind of answered both of those questions. They were kind of one question, kind of 2 questions. But the thing that the takeaway for me that's so interesting about it is that not only does it, by training yourself in that way, it makes sleep paralysis, I assume, less traumatic each time it happens because you remember that it's sleep paralysis quickly. But also, you mentioned that it actually reduced the number of sleep paralysis episodes as well.
Yeah.
Which is so interesting.
Exactly.
By 54% in the study.
Wow.
That's a lot.
Yeah, got it. I mean, look, it's a small study, but it's definitely a big number there. And I think you're right. So, it gets to what we were talking about, how fear and anxiety propels it, right? So if you have less of something that's fearful, right? Less of something that's potentially trauma-inducing, or at least panic-inducing, well, then you have less of that, then you have less anxiety overall, and potentially, so yes, I think those are all, that's a good observation there, and I think it's striking in a way, but yes, we need to do more research, but definitely.
And I guess you're kind of interrupting that, because at the start you sort of described a downward spiral, especially in situations where you have cultural ideas of demons and monsters, where you've got this downward spiral where once you've got it, it just gets worse and worse and worse. And you, by the sounds of it, your method is sort of interrupting that, and then it kind of gets better and better and better, because you are not only are you're making it less traumatic to have sleep paralysis, and then because you're then less anxious, you then have less sleep paralysis. And then because you have less sleep paralysis, you get less anxious, and it's like the opposite way. It just keeps getting better.
We're trying to break the vicious loop. Exactly.
Yeah.
We're trying to a vicious cycle. We're trying to break that, and that is exactly what we are hoping to achieve. So that's great. You definitely that's right. We're hoping to achieve that. And look, also by you trying to, like in psychopathology, people with mental illness or like chronic anxiety or things like that, which is typically people with those disorders will have more sleep paralysis. So it's much more common in people with anxiety and trauma. We find a key feature in these disorders is a lack of internal locus of control or a sense of agency over their own lives. They feel that, external factors are controlling them. And so by you, in such a terrifying situation, being able to manipulate that and control that, well, that gives you a sense of agency and empowerment. So we're empowering you as well to deal with other experiences in a way. So at the risk of sounding like it's a solution for everything, but it's a way of empowering you as well, right? Because you are now learning how to battle these demons, literally or not so literally, right? But hallucinations and terrifying experiences, and we are empowering you by giving you ways to face your fears, which is something that is sometimes can be lacking in these conditions. So yeah, definitely.
That was a really interesting paper to read. Now, obviously, everything is linked in the description, so if you want to see more of this, go down there and look at that. One thing you mentioned is that this could kind of be built into a sort of smartphone app or something that could be sort of sent out remotely to people. And you did it. You sort of did the study online, sort of over sort of video calls. But what I noticed is that it wasn't sort of the first time in your career that you'd suggested a sort of potential app as a sort of non-pharmacological method of treatment for something going on in the brain. So the sort of OCD app that you came up with. Would you mind giving us a little hint of what that was about?
Absolutely. So this was an app we developed working with Barbara Sahakian, professor at Cambridge, with Ramachandran. I just want to acknowledge my great mentors and collaborators, of course. And so what was this about? No, I've been lucky to have really great mentors. I can't take credit for any of this. It's my mentors and just being fortunate in that way. But yeah, so it started in California. And the idea was, look, if we have centers in the brain that allows us to feel what other people are feeling and, create a sense of projecting and seeing projecting our own mind to other people's minds, right? A sense of all that stuff we talked about in dreams. So it's kind of going from that. You can see it's all related in a way. We thought, what if somebody with OCD symptoms, okay, so obsessive compulsive disorder, these guys with this disorder will wash their hands all the time. They feel everything is contaminated, like touching a doorknob or, touching a chair like this. It's all contaminating, right?
We've got an episode on that if anyone wants to go back and listen to that episode.
Yeah.
We do? Sorry, continue.
We thought, look, and this was Ramachandran and I, Professor Ramachandran, UC San Diego, and we thought, so look, what if somebody with OCD, right, watches you, you're touching something he sees as contaminated, would he feel contaminated in his hands by simply watching you? And the answer was yes. It seemed like people with OCD tend to feel that. So we did studies at UC San Diego, at Harvard Medical School. Very interesting. But then interestingly, we thought, what if somebody with OCD touches something contaminated? So let's say Baland has OCD now, and he touches something contaminated, and the experimenter over there washes his hands. Would he feel relief by watching him wash his hands? And the answer was, surprisingly, yes. So his disgust would go down, about 22%. It's something equivalent to actual hand washing in terms of disgust, which was really striking. So imagine this. And this was a study we did again over in Boston, where we had patients with severe OCD and their hand washing urges after they touched something, they felt was contaminated. They feel like, my God, my disgust is going down in a compelling way. I thought, wow, this is fascinating. Then we had a mischievous twist on this. I can be mischievous sometimes. You may know. I thought, well, look, what if Joe over there, so I have OCD symptoms, right? And there's an experimenter called Joe. He touches something, with the patient with OCD feel contaminated by simply watching him. And we know that is the case. So yes, I felt contaminated by watching somebody else touch something contaminated. But what if a third person over there washes his hands? Would I feel relief, by having somebody else wash their hands after they touched it over there? So it's like, now 3 persons involved. And it turns out, yes, again, the brain doesn't really differentiate in these cases, it's almost like our brains are hooked up emotionally, at least, right? In a way where it overrides logic. The fact that I know I'm Baland, and Luke knows he's Luke, and Corey knows he's Corey. We're overriding all that, and in a way, experience other people's emotions and sensations. Quite fascinating. Now, while all this was going on, we thought over at Cambridge, well, look, what if you watch a video of yourself over and over on an app of you touching contaminated objects? Would that lead to a sense of anxiety and contamination feeling? And would that over time lead to a sort of desensitization? And what do I mean here? Well, it turns out the main therapy for OCD at the moment, psychological therapy, is by having the patient touch something that he fears and feels is very contaminated, like a toilet seat, over and over, for, let's say 30 minutes. That's the way you treat them. So you bring in the patient, you say, look, Joe, so the patient is Joe, comes into the laboratory or the clinic. You say, you have to touch this toilet seat for 30 minutes over and over, and then we prevent you from washing your hands. And what it does, this is the way that they're treated. And it actually can work, because what it leads to is a sense of anxiety and fear, but over time, a sense of you've conquered your fear. So your brain habitually sort of becomes normal. It normalizes it in a way, right? So that's interesting. But the problem with this therapy often is that about like 25% of people will refuse to start this therapy, and 20% will drop out. And you have about 50% not benefiting from it at all, given all the fear and all the stress. So using this app is a way to circumvent that. It's a way of get out of that, fear that the patients have to face by using an app where we say, look, Joe with OCD, don't worry, we won't have you touch something directly. You'll use this app. And what would happen over time? Well, we found that using this app for 7 days, we saw a great decline in OCD symptoms. Now, mind you, this study we did was in people with OCD symptoms, not the full-blown disorder. So it was first step in the science track, but it was very interesting. Now, we had a second app, and this was another intriguing way to also treat OCD using the washing methods. So this was more interesting because it's totally novel in the way that we had people with OCD symptoms watch a video of themselves washing their hands. Okay. And we thought, what would happen? Would it, maybe lead to disgust reductions? And then over time, they feel like they don't have to actually go and wash their hands in real life and maybe cure them or at least reduce the symptoms. And we found that after a week, again, we found that it sort of reduced OCD symptoms about 20% or so in these people. So yeah, quite interesting and definitely something worth. Now we're trying to do the clinical study in patients with full-blown OCD, but definitely interesting.
That's really interesting because I think that, like, obviously with OCD, I think one of the things in the DSM is spending an hour a day with the sort of doing the sort of compulsions or spending an hour a day on that. So obviously just having that smartphone app could cut down on that time, even if it wasn't helping with the disgust. Just checking your phone instead of having to go and wash your hands and getting your hands all raw. That's just a fantastic way of dealing with it. I'd like just looking through sort of the research that you've done, I found it very interesting. Just sort of the ideas that I'm going to gush a little bit right now, but the ideas that you've come up with, obviously, from the MR therapy to this sort of this app, and there was a sort of stray thing you mentioned in one of the lectures I was watching, which was, I think you were talking about thoughts you had on an experiment potentially to figure out how time perception worked in dreams, which obviously is something really interesting because you guys know that your time perception in dreams is messed up. Like, I once had a dream that I had 2 twin boys and I raised them for so long, and then I woke up and they were gone and I was grieving for about 2 weeks.
Yeah, I do remember this. I remember you telling me about
I was a teenager. I still think about them sometimes, but obviously I didn't. Yeah, I know.
I saw a story once of a guy who took some hallucinogenic drug and lived like a whole life, and then came back and like 10 minutes had gone past.
Oh God!
Yeah,
that is just
horrifying.
insane.
Well, it's insane how much you can sort of mess up with the time perception in your brain. So I was just curious about if you could sort of elaborate on that to any degree.
Oh yeah. Well, so definitely. So it's very interesting. What your dream is fascinating. So I just want to make sure. So you saw yourself having twin boys, and they died, and became sad, huh?
Oh no, they didn't. No, they didn't die.
When he woke up.
No. I raised them for a good few years. And then I woke
wow.
up and obviously they weren't there anymore. And I had to go to school that day and I was just feeling really low for a couple of weeks because, you know, I'd lost my boys.
I miss my kids.
I'd lost my boys.
Yeah.
Yeah.
No, it's fascinating. That's more fascinating maybe than anything that I've heard today. You're having a dream of having twin boys, and you become so attached to these twin boys, these agents you created in your dream, and then you wake up and you're sad for 2 days. Look, what is that about?
I just realized that's the plot of WandaVision, by the way.
Sorry, was it
Oh,
2 days?
yeah.
Was it 2 days or 2 weeks? You were sad.
I was sad for like 2 weeks.
I mean, he's remembered it to this day. So
I still
he must be a
remember
little
it. No,
bit sad
I
still.
gen-
This is a trauma point for you, isn't it?
It was actually really, really awful to go through, waking up and being like, oh, they're not there. They don't exist. Like, worse than they're not there, they don't exist. It was very weird. It was a very weird thing to go through.
You know, it's fascinating how your dreams are spilling over into your real life, and that's what I find one of the most interesting things is when you have a potent dream, a salient dream like that, and it starts affecting your real life. I certainly had a few cases of that I've seen, and it's fascinating how it then impacted you. Wow.
Yeah, I think it's interesting because for me, it's obviously intellectually, I was fully aware. Yeah, these you know, this was a dream, but that doesn't change the emotional sort of
attachment.
Yeah,
you
the
feel.
emotional attachment.
Yeah.
Like, I mean, obviously waking up, I felt these strong emotions, then suddenly they were gone. I'm just, oh. Like, so the emotions that you're feeling in dreams are real.
Exactly. No, it's fascinating. So who are these people we're having meaningful conversations with in our dreams, right? So I've had meaningful conversations with folks in my dream. There's one particular dream I had a very, very meaningful conversation with this person. And, I felt like, my God, I connect with this person on so many levels, right? What's going on, right? And then suddenly this person told me a joke. And I started laughing so hard that I woke myself up from laughter. And then I went, look, as a scientist, who's this other person, first of all, that I'm connecting with so deeply? And then secondly, if he tells me a joke and I find it funny, well, joke's only funny when you don't know the joke. That's the whole point, right? You have to have a storyline and then there's a punchline of the joke. And if you know that punchline, it's no longer funny. But somehow my brain temporarily suppressed the information of the joke to make the conversation more meaningful and joke funny to me. So, the brain works in these mysterious layers, which is striking, right? But let's go back to the whole time perception thing, which goes to the whole idea of definitely time is something that your brain processes, just like the era of time, the sense of self, the sense of ego. So you notice in dreams, it's mostly about ego construction, creating other people. It's rarely about like you going on Skype and just looking at a computer, even though you do that for most of the time, but it's about things like ego, and time is warped. Places, people are sense of space is warped. Now, in terms of time perception, yes, the question is, what is that like in dreams? Is time slowed down, or is it faster? What is it like during dreams? And one way to test that would be to infiltrate a dream. Okay, like a dream hacker, right? So you infiltrate a dream. How would you infiltrate? How do you infiltrate a dream, right? So now I'm almost like Inception, like chat we're having. So. Well, we know that you can externally influence the content of the dream by giving the person some sensory input. So if you're lying and sleeping and you find yourself in a really, really cold room, well, then you might dream that you are in Greenland and you are, covered with ice, for example. Well, that can happen. Or if there's smoke outside your house because of your parents are barbecuing, let's say, right, and you're sleeping, then you might dream that you are in a war situation and there's smoke everywhere. And so what we know that you can externally manipulate dreams. Now, of course, one problem with this is that if you overdo it, so if let's say Corey is dreaming and I put a lot of water on him, he might wake up. So there's also that part of it. So we don't want to over stimulate your sensory system, right? So that's there too. But we thought, look, what if somebody is sleeping? Right. And whilst he's sleeping, we'll pour some water on him. We'll sprinkle it so he doesn't wake up from the dream. We'll sprinkle water on him. And let's say we do this during the REM part of sleep where he's dreaming. And we do this. And let's say the person is dreaming and he's constructing a dream in his mind, in his brain. Now, would this person go, look, so first of all, let's say we sprinkle water on him and wake him up instantaneously. So that's important to add. So we sprinkle water on him and then wake Luke up right away. So there is that component. So it's like right away, right? So the question is now, would he have the time or the perception in his dream that he's able to say, look, I was walking in the forest, the clouds came out and it became cloudy. I took out my umbrella, and then it started to slowly rain, and I woke up. Or would he go, I was walking and a tsunami hit me right away, right? What would he report in that situation? And that is the question, a way to explore how time is perceived during dream, and how the time is felt to that person. So definitely, that's an interesting experiment that we are thinking about doing. And this was something with my colleague, Ramachandran, we thought about doing this.
Just on that sort of idea, would you not have an issue maybe of the person or the brain sort of editing backwards, as in waking up and being like, oh, I had this dream, and this is what happened. Do you know what I mean? And in that sort of, you can kind of make, your brain can kind of make things up sometimes, or like edit what has happened previously. To sort of fill in the blanks.
So you're saying that they would potentially, well, look, I think if you did it on enough people, right? So if you had a big sample size and you do it during many, many times, you might find a pattern there of people, maybe saying, oh, there was enough time to elaborate, certain details about how long it took for them to perceive the water. You know what I mean? Like, so that is the question over, definitely you might find cases of people not even dreaming, or, you know what I mean? That might be, so it's not that clear cut, but if you did it on enough people, you might find a pattern of them saying, well, I had enough time to incorporate it in a really sort of slow way. So that would be a hopeful thing you might find.
No, absolutely. Fantastic.
That's interesting, actually, because I remember reading I don't know if it was I think it was just a paper, an article in some scientific journal that was talking about how like the two different possibilities of how you dream, whether you dream throughout the time that you're dreaming, or whether you construct a narrative in the minuscule second as you wake up. As you go from sleeping to waking, you construct the entire narrative.
Your brain
there.
just pulls together all the ideas and feelings and stuff.
Yeah.
It's interesting because you forget like 95, but then my question for that would be, because we know that you sort of forget like 95% of your dreams, right? Or thereabouts.
Yeah.
Very quickly,
So then,
I think,
would that be you construct it as you wake up, then immediately forget it under that sort of theory?
I don't know.
Said?
I literally read it in passing probably like a year ago.
Oh, okay.
I don't know. I wonder if you had any thoughts on that.
No. So dreaming occurs while we are in the REM stage of sleep, right? So there's definitely it's created while you are in sleep. In fact, during people that lucid dream, so people that can become lucid, and you become lucid potentially by telling yourself before a dream, I want to be lucid. I want to, pay attention to weird things and wake myself up. So you're almost, again, priming yourself. Or some people wear goggles. So they see a certain amount of light, like say 3 flashes of light. That's a reminder that I'm in a dream. So wake myself up.
Yeah.
So we'll do that all the time. So, and you can actually, then you can communicate with people who are outside the dream. You can say, look, I'm in the lucid dreaming. I'm doing this. And then you communicate with the person outside using your potentially your eyelids, or there's research on that recent stuff. So no, dreaming is not something that happens. In fact, dreaming occurs. The dreaming brain is a very much a product of how the brain looks. So look, the brain during dreams, right? What does the brain look like? We said during dreams, your brain is hyper emotional, and that's because the emotional part of the brain is overactive during the REM phase, right? And the CEO of the brain is weak. So that's why you can't control your emotions. That's why dreams are instinctual. Then you have things like chemicals in the brain that has to do with focus and attention. Things like noradrenaline. Have you heard about adrenaline before? You know adrenaline, right?
Yeah.
Hormone that makes you focus and stuff. Now, adrenaline and noradrenaline are absent during dreams, and that's why our mind is all over the place. There's lack of focus as well. We take ideas in the world and connect them in weird ways, and then sense of logic is knocked out. And so there's a whole neurochemistry that explains all of this stuff. So dreams happen during they also happen sometimes outside REM, but it's this different type of dream. Vivid lifelike ones occur during the REM stage.
We've not got much longer left, so I think I've got one question I'd like to ask, and then our patrons have asked us some questions, so you could join our Patreon if you'd like. You get to ask wonderful questions to wonderful experts like this. So there's the sort of idea that dreams sort of prepare the brain prepare the sort of self for things that happen in waking life. I think I remember, maybe a lecture at one point you might have said something along the lines of, if you had a dream, say, fighting a bear, the next day you wake up, that task you were going to be some percentage better. I think you said maybe 20% better at. Sorry, that's off the top of my head. So yeah, what I think is interesting about that and what we sometimes do on the podcast is talk about just ideas, theories, things that could potentially happen, is using dreams in some kind of therapeutic sense. You know, if dreams are kind of a way for the brain to prepare itself for future events or things that are upcoming, if someone has, you know, using brain as a sort of therapy for certain types of mental illness, PTSD, things like that, you know, sort of in the same way, I suppose, as the sort of exposure therapy with OCD, but in a much sort of safer way in the brain.
Yeah, definitely. I mean, REM sleep and dreams, right? REM dreams, because of the lack of adrenaline, and adrenaline is also involved in things like fear and things like that. You know, it is a way to also remove the fear that can go with a certain event. So REM dreams are in a way therapy in itself. It's a way to emotionally deal with certain things. It's a sort of emotional first aid. Do you know, like, have you had the experience of like fighting with somebody, you know, verbally, whatever, and then you have a dream, you're angry at somebody, then you go to sleep, and then you wake up, you're not as angry anymore, or something like that.
Yeah.
Process emotions during REM sleep and REM dreams. So it has that component, and it's very therapeutic in that way. And lucid dreams, for example, yes, it might be another way to have a sense of agency and enact certain things. So that's very interesting. And then I want to add on the whole the virtual reality like simulations in your brain. So you run these scripts, and that's why it's not only a way to deal with the past, right, but also a way to prepare yourself for the future, because you can, if you see yourself in these scenarios, you know, it can be a scenario of you're not fighting a bear. It's not really realistic these days. You know,
that's every Saturday for me, you know, just taking on heading down to London Zoo, taking on a bear. Yeah.
And you'll be 20% better at it if you get the dream first.
Right. So you see yourself in a certain situation. It could be an exam type of situation. You're late for an exam or something like that. Any kind of like thing that you're dreaming that you want to make sure that when you encounter that in real life, you're well prepared for that. Well, that your dreams allow you to be well prepared for that. So it does allow us to run these virtual reality scripts for the future as well. So it does have a effect on the past, but also on the future, and definitely, yeah. So.
Oh, fantastic.
I find that really interesting because I saw a thing about an Olympic skateboarder who was talking about how she practices skateboarding in her dreams and then wakes up and she's probably better at skate. Like she practices like a trick and then she goes to sleep and she wasn't good at it. And the next day she's better at it than she was when she was practicing it last night. Right. And what's so weird about that is that our brains must have such a fantastic like physics simulation system in them. If you're able to practice skateboarding, which is not a thing you have encountered like genetically across millions of years. We don't have the physics of a skateboard hard coded into our DNA, but we must have these like incredible, like gravity must be well coded into our simulations in our brains.
But then we're very good at recognizing sort of gravity. I don't know whether it's inbuilt or through experience, because you know, in a video game or in a film, if an object doesn't fall correctly,
right,
you spot it. You can tell.
Yeah. It's a very interesting one. And with the skateboard, look, it's not that different, for example, than you moving over a sort of, what do you call the tree in a sort of a river, you know, in the prehistoric days. You have to cross, you know what I mean? Like that balance.
Yeah.
You can supply your brain, and all this motor learning, you know, occurs actually during slow wave sleep. So that's a stage before the REM sleep. That's where you have a lot of the motor learning and things like that occur. And yes, you're absolutely right. So if you teach somebody on a certain motor skill, and then you test them before they go to sleep and after they go to sleep, you know, just by sleeping, you might be up 20% better at whatever, you're taught, you know. So, you know, by sleeping, you become potentially much better at things. And your brain is very malleable and plastic in that way. And dreaming is certainly one way to, become better at motor skills. Yeah. So that's fantastic in that way.
Fantastic. Well, we don't want to take up too much of your time. If we just maybe ask one more question from our patrons. This one is from Willow. So Willow, they say, do you think it will one day be possible to plug into the brain and be able to watch or record someone's dream?
Watch and record somebody's dream. That's a great question. I think it's a great question. It means so I'm having this striking sensory experience of me being in this landscape. and meeting, let's say I'm meeting you in my dream, right? So we're having this conversation in my dream. Would I be able to literally put that on a screen as vivid as that? The question, I think that would be quite difficult to do, right? So because there's no a Corey residing in my brain. No, you know what I mean? There's no image there. There's all neurons firing. And a lot of these things occur in those like inferior parietal lobular area of the brain where you integrate information in the world and create these images, compelling images in the visual parts of the brain. So what would you exactly see? So it gets to a very deep fundamental question is where does consciousness, reside? Where does all these images reside? And it's a very complex issue. Would we ever see that? I never say never. I like to be open that you can get at things, but we are far from being able to project your dreams onto a screen. I mean, it's just, for now we have to, work really hard at it, but never. I'm a scientist, so I want to say, look, everything potentially, a lot of these things are possible.
That's absolutely. So that's really interesting because it sounds like what you're saying there is sort of that dreams are less literal and more sort of experiential. I mean, in that it's how you experience it and your brain interpreting that and saying, oh, this is what you're seeing, rather than you know what I mean? Am I making sense? Than actually seeing it. Yeah. Because I think that's and I think just one last thing. Have you heard of aphantasia at all?
No, what's that?
This is something we've spoken about on the podcast before. It's the sort of having a blind mind's eye. So most people, when they sort of close their eyes or imagine something, they're able to sort of see it.
Yeah.
There are some people obviously who can't. It obviously exists on a spectrum. There are some people who can't, but obviously those people that can't can still see things in dreams. Do you know why that might be? If you're not able to sort of imagine things visually, but you're able to sort of see those in dreams.
No, it's interesting. It has to do with there's a lot of things here to unpack. So the way to put it is that there's a part of the brain called the frontal parts of the brain, right? That has to do with logic. So if these are knocked out by a stroke or trauma or something like that, you will be totally impaired in wakeful life. And so you can't make decisions right. You have all these cognitive mental problems, but your dreams are intact. Why? Because these parts of the brain are already knocked out during dreams. So the dreams are just like any other person's, right? But if you have a part of the brain known as the inferior parietal lobule, where you construct images and take, input from the visual part of the brain and, all that, and you mix them together, if that part of the brain is knocked out, then you can't dream, for example, right? So it just shows you it's really, there are certain parts of the brain that's really responsible, or at least key parts of the brain that's responsible for dreaming. And so, yeah, I think that would be my thoughts on that.
Fantastic. Well, great. I think that's sort of brought us to the end of the episode today.
Yeah, that was fantastic.
That's fantastic. Thank you very much for joining us. Is there anything you'd like to plug to our subscribers before we go?
No, it was excellent. I enjoyed chatting with you, and if you wanna, I'm on social, so you can join me there if you'd like. But yeah, it was wonderful, fantastic.
Well, fantastic. Thank you very much. If you'd like to see more from Baland, you can find his links in the description below.
Yeah,
you guys are looking.
Go check out Baland's YouTube channel. We had loads of fun looking at that.
Yeah, I spent hours watching everything. All fantastic stuff. But again, thank you very much.
Much of it filmed exactly where you're seeing Baland right now as well.
Thank you very much for joining us. Well, massive thanks to Dr. Baland Jalal for coming and joining us. That was good, wasn't it?
Absolutely.
That was so much fun.
Bloody fantastic. But before we go, it's time for one tiny little thing.
Dun, 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 dun.
It's a quick fire quiz.
Baland edition.
Baland's edition.
Sleep paralysis edition. It's both.
So, my question for you is going to come after I've asked you what your buzzers are, and also after I've told you what the rules are. So the rules to this are very simple. It's the same every single time. I ask one question between the two of you. The first person to buzz in with the correct answer after I finished asking the question wins. What do they win, Jamp?
Nothing.
So, Luke, what is your buzzer?
Baland.
Jamp, what is your buzzer?
Good. Jalal.
Yes.
It's to listen to this, guys.
Oh, yeah. Hey,
Okay.
Baland.
So my question for you both is, what does MR therapy stand for?
Baland Jalal. At least we said it in order.
Hey, we said his name.
Luke, I think you got that one first.
Do you want to say it at the same time, Jamp? We can share this one.
I think I've got it.
Meditation, relaxation, therapy.
Therapy. I got,
Wow.
forgot the song.
Completely in unison. Well done. You
Go
both
us.
win.
We both remembered it.
Absolutely nothing. Well done.
Hooray!
Good job.
That's what I've always wanted.
Don't leave me hanging. There we go.
And I think with that, it's the end of the show. But before we go, I would like to just say a few things. One, go and join our Discord. Do it now. That's
down
where our
there.
patrons ask questions. You should join our Patreon too, but join them both. It's better for you. Makes you nice and healthy.
Yeah, we're doing it for you, really.
No other reason.
Before we go, we would like to thank all of our patrons and thank you for watching. You can find the full references for this episode in the description. Subscribe for new episodes every Sunday, and why not leave us a nice wee comment? You can support the pod at patreon.com/SCI Guys, or join the community at Discord, on our Discord, SCI Guys Discord, or you can send us an email at sciguyspod@gmail.com.
That's sciguyspod@gmail.com.
SciGuysPod.
You can follow me at NotCorey everywhere.
You can follow me at Jamkin everywhere.
You can follow me at Luke Cutforth everywhere.
And you can follow Dr. Baland Jalal on YouTube, down linked in the description. And goodbye.